to go over some normal parameters. The next skill session, we will learn pulse and respirations and blood pressure. And I like for the students to be prepared with the normal ranges before we actually implement those skills. So we're going to start off by talking about the normal ranges for the heart rate or the pulse. What's the normal range for the heart rate or the pulse?
The normal heart rate is going to be 60 to 100 beats per minute.
That's correct. 60 to 100 beats per minute is the normal range for the heart rate. So if my heart rate is 59, what would you call that?
I would call it bradycardia.
Bradycardia, that's correct. When the heart rate is low, the medical terminology for that is bradycardia. What if my heart rate was 105? What medical terminology would you use?
Tachycardia.
Tachycardia, that's correct. So when the heart rate is elevated, we're utilizing the medical terminology. The word for an increased heart rate is tachycardia. Okay, so we have tachycardia for an increased heart rate, and we have bradycardia for a
decreased
heart rate. Yeah. All right, so if you capture measurements and your patient has tachycardia or bradycardia, what do you do with that information?
You have to inform the charge nurse.
That's correct. If you have any abnormal vital signs, whether those vital signs are related to the heart rate, the blood pressure, the respirations, the oxygen saturations, you're going to notify your charge nurse, which may be an RN or an LPN that you have been assigned to work with during your shift. So we're going to talk about respirations, or the medical term for increased respirations is tachypnea. So if my respirations was 8 breaths per minute, what medical term would we call that?
Bradypnea.
Bradynypia.
Bradynypia.
Yes, so when the respirations are too high, that's called tachypnea, and when the respirations are too low, that is called bradynypia. One thing to help you remember, the prefix tachy means fast, and the prefix brady means slow.
Okay.
What's your average blood pressure?
The average blood pressure is 120 over 80.
120 over 80, and it's generally written similar to the way a fraction is written. During the systolic phase, what is the heart doing?
The heart is compressing.
The heart is contracting. And during the diastolic phase, what is the heart doing?
The heart is resting.
So during the systolic phase, the top number represents the systolic phase. The heart is contracting. And during the diastolic phase, the heart is
resting.
Good job. The heart is resting. So it's important that we know our residents' baseline vital signs on admission. Right. So what do we call the vital signs that we take on admission?
They call baseline vital signs.
Good job. All right. So utilizing or looking at the baseline vital signs will help give us insight to what range the resident's vital signs run in. So if the resident's vital sign is 130 over 80 on admission, and 4 hours later you take their vital signs and it's 131 over 81, would you consider that an emergency, and should you notify the nurse?
No, because that's within your what you call it?
Parameters?
Your parameter. That's in your parameter.
For that patient,
yes,
based on their
admission, based on their vital signs or their admission.
Exactly. Now, your top number is a little elevated. It's still 130, and we know that from 120 to 129 is our normal range.
Right.
So we would mention to our nurse that the top number, the systolic number, is slightly elevated, and we will also inform her of what the baseline vital signs were on admission. Now, if you are capturing your measurements, and for example, you are capturing a blood pressure and you get an abnormal measurement on your left arm,
Mm-hmm.
should you take a measurement on the right arm?
Yes.
That's correct. If you get an abnormal vital sign or abnormal blood pressure on the left arm, you want to automatically go ahead on and take the blood pressure on the right arm to compare your results. And then you would do what?
Then you would tell the charge nurse.
You would notify the charge nurse and then also show her your findings.
Right.
All right, good job. So, what is the average temperature?
98.6.
That's correct. If your temperature is 99.9, should you notify the nurse?
Yes, ma'am.
All right, you're going to notify the nurse. Even though it's not technically a fever, which is 101.1.
Yeah, and then it's febrile.
So at 101.1, that patient is febrile.
Febrile.
But what about the patient with the temperature of 98.6?
Is without fever.
That's correct.
Yeah.
Afebrile.
Mm-hmm.
Now, if you were rounding and you were preparing to take your resident's vital signs and you're going to take the temperature, you notice that this resident is drinking coffee. Can you take the temperature at that time?
No, ma'am, because it's not going to be accurate, and so you have to wait for at least 10 to 15 minutes.
That's correct. The temperature of the food or liquids can change the oral cavity of the resident's mouth. So if you're trying to take vital signs and your resident has eaten something or drank something cold or hot, it's best that you come back 10 to 15 minutes later in order to get accurate measurements. Good job.
Thank you.
You're doing so well. Let's talk about pain. Pain is our fifth vital sign. When you're doing your measurements, when you're getting your vital signs, it is a good practice to ask each resident if they are having any pain. If you ask a resident if they're having any pain and they say they do, what would you do with it?
You would have to believe them.
You would believe them, and you would
inform the charge nurse, and then you have to write it down, and then you notify the charge nurse and show them the, what the residents say.
Good job. So is pain subjective or is it objective?
Subjective.
It is subjective. Why is pain subjective?
Because you cannot measure it and you cannot see it.
Good job.
Yes.
Oh my goodness. You are on the ball. So tell me about phantom pain.
Phantom pain is the pain that, let's say they have to cut your leg, and that's the pain that you feel. The body is taken away. That's how I would explain it, and that's how I understand what phantom pain is. Like, the pain where the body has been taken away.
That's right. The person has had an amputation and is still feeling pain in the limb that has been amputated. This is called phantom pain. So is it real pain or imaginary pain?
Oh, it's real pain.
It is real pain
Yeah.
because pain is subjective.